Shannon DeConda here, representing NAMUS, which is the Educational Division of Doctors Management. You can find out more about us and all the educational and audit tools and resources, as well as documentation resources we provide for your physicians at our website, namus.co. So today I wanted to bring you a little educational tidbit, again, on E&M documentation improvement. Also, if you're a coder or auditor, another tip on how to audit those challenging sections of E&M. That would be the third column of our MDM table. So I have my MDM table here nice and handy with our AMA 2021 documentation guidelines. I'm going to be referring over here to our third column. Now, this third column is appropriately entitled, I'm going to shorten it a little bit here for you to make it specific to what I want to speak to today. It is the risk of complications for patient management and treatment. Now I want to specifically point to, it is the risk of the management and treatment. Now under this column, there are examples that are listed here that the AMA has provided. There used to be more examples there. There's some examples that still remain there. AMA took some of those examples off the list when they gave us 2021 documentation guidelines. And we know that there are a lot of different treatment options and treatment plans that do occur within the everyday patient encounter that aren't on here. And honestly, that's what we get a lot of questions about at NAMUS. They come in through our NAMUS Ask the Auditor from our members, and they get posted on the NAMUS forum. So I thought this would be a good question to bring up during one of our video clips. So one of those questions is on consults and referrals. Not consults and referrals that come into the provider, but rather those consults and referrals that go outbound from the patient encounter. So here's what I'm talking about. Our provider sees a patient today, and during that encounter, our provider makes the decision to send the patient for a consult to another provider. Now, when we review our third column of our table, our MDM table, there's no place that just jumps out and says, choose me for a consult or referral for that patient being sent to another provider. Well, again, go back to what the title of this column, this header is, risk of treatment or management. How much risk is associated with sending a patient for a consult? Not much. Sending me to another provider doesn't have much risk in it. However, we also get to give our providers credit under 2021 documentation guidelines, risk associated with considered treatments. On page 6 of the original 2021 documentation guidelines. And this specifically talks to this particular treatment and management options. So what we could understand is if our provider is, for example, an orthopedist, or better yet, let's consider an internal medicine provider, family practitioner, who has been following a patient who has chronic pain. And they've been giving this patient chronic pain management medications. And now it's been long-term enough, and they need to now send this patient on to a pain management clinic for further follow-up. They are now sending that patient as to another provider. They know that patient is going for long-term pain management. Now, if they write the note to say consult to pain management, referral to pain management, transfer to pain management, that's very little for me to go on in the risk of treatment plan. And it's not much by way of risk. However, if instead the treatment plan is written to say that the risk of the treatment management is the ongoing risk of managing the consult to manage that patient through prescription drug management, that now shows the risk and the category of risk to better allocate that problem. What about a patient that comes in and my provider's seeing that patient and our provider can very easily identify that this patient has the need for consideration for decision of surgery by another provider. So our provider is going to need to send this patient to another provider for consult for decision for surgery. So that consideration, those treatment recommendations, if written appropriately, could have that complexity. Now, again, that's not going to be our sole determining factor in determining that overall level of service for that particular encounter, but it could play a part. So again, educating our physicians to write those consult referrals and transfers of care more effectively can help us in better understanding how to allocate the levels of risk for those particular encounters. So I hope this tidbit was helpful for you, whether you're an auditor or a coder or a physician. Leave me a comment and let me know if it was. If you have any questions about it, feel free to send me an email or also drop me a comment. In the meantime, I hope you have a great day. Thanks.